Jason Brownweasel is on the road to recovery. He lives on the blood reserve with his brother, niece, and nephews after struggling with an opioid addiction. This after living on the streets of the nearby city of Lethbridge, where the homeless population is predominantly Blackfoot. Brownweasel says deadly overdoses on the streets has become the norm.
I've lost my own brother to it. I was saving up to 8 to 9 people a day, walking around with these Naloxone kits and just saving people left and right. I think we're losing more people to this drug than we are losing to COVID.
The opioid crisis for Blood Tribe members has become a pandemic in itself. The community has been hit hard with waves of overdoses, and it's only gotten worse since COVID-19.
In the past year, Blood Tribe has lost 194 members to substance-related deaths.
Dr. Susan Edelman of the Blood Tribe Health Department says the community has made the issue a priority with the help of detox departments that help users during withdrawal. She says overdose rates have been lowering on reserve, but off reserve?
And the interesting thing is that most of those are actually in Lethbridge and Calgary. They're not on the reserve. So to me this says the reserve is doing a great job in taking care of its own people, but they're not getting that care off reserve at all.
In early August, 2 nonprofit organizations, Moms Stop the Harm and the Lethbridge Overdose Prevention Society, sued the Alberta government for new rules around safe injection sites. Those rules include the need for clients to provide an Alberta health card and ID.
So by asking someone who probably doesn't have ID to provide ID and actually identify themselves when they're doing something that they feel they could be punished for anyways, they're just not going to use that facility.
Dr. Edelman says she's a supporter of those nonprofit groups and says around 80% of users at the Lethbridge mobile injection site are Indigenous. How many people on the streets actually carry a health card?
From my experience, not very much. Maybe 2 out of 20 would have that, would have their medical card. And if they did give it, they would lose it just because of, them being overdosing and people practically rummaging through their stuff while they're overdosing.
Brownweasel says safe injection sites prevent relapsing while addicts wait to get into treatment centers, and no access to those sites mean more deaths.
They're being put alone most of the time, and they're overdosing and dying alone.
Brownweasel says with the success rate of the Blood Tribe, more members struggling with addictions are going to Lethbridge for easier access to the drug. He encourages them to continue carrying and using naloxone kits and to go back to the community where help and cultural practices are accessible.
A person like me can do it. Why can't anybody save one person at least? If not that, save the rest of them, is because they need it. They all need it. They all need this help that they're not getting.
Tamara Pimentel, APTN National News on the Blood Reserve.